All right, this is probably what you think of when it comes to nose jobs, invasive surgery, major changes, and lots of downtime. But there's another option out there that also promises to change your profile without going under the knife. It's called the injectable nose job, and here's how it works. To most people, it was probably imperceptible, but to Pam Cavalcanti, the bump on her nose needed to be fixed.
I just hated taking profile pictures and seeing, when I look through my photos and see side views, I'm like, ooh, I just hate that little indent there.
Luckily for her, a syringe of Restylane Cosmetic Filler fixed her problem in less than 5 minutes. This is the injectable nose job.
And that is pretty much it.
Your profile changed in the span of time it takes to brush your teeth. But Dr. Roger Bassin of the Bassin Center says it's not for every person who's unhappy with his or her nose.
A lot of what we're seeing with this type of procedure, patients who just have that little bit of a dip in between the areas of the nasal bridge as it gets to the center of the nose. I really wouldn't recommend this for somebody who has something that we would call a misaligned nose, or something that's a little bit diverted when you're taking a front view, because that's more of a structural issue that would really have to have a structural type of procedure to fix that.
So have a seat over here.
Pam is brought into the treatment room. The syringe is filled with Restylane.
A little stick and a burn.
And a few injections and a little molding later, and the bump is gone. And the best part, no downtime. Take a look at the before and after pictures. So, is she satisfied?
What do you think? Very good.
And as for the pain,
didn't even feel it. The first one you felt like a little pinch, and then after that didn't feel any more.
And best of all, no more fear of the camera.
And now that I know that I have this, I wouldn't mind taking side views, photos.
Dr. Bassin says he is just as pleased.
I'm able to affect an immediate change, and you can see a patient, they just walk out of here, and the confidence boost that it gives our patients, and that's the most rewarding from my point of view.
Now, the cost of Pam's procedure was about $500. Prices will vary depending on the amount of filler used. There is a downside, though. The American Society of Plastic Surgeons says because the results only last anywhere from 4 to 6 months, it does require maintenance, which of course can be costly. But the ASPS adds it is a safe procedure when performed by a properly trained, board-certified physician. Bob?